Okay, so I'm doing an injury evaluation of injuries of the forearm and elbow. So history questions that I would ask are what increases and decreases your pain? How long has it been since your symptoms started? What position was your body in when you were injured? What were you doing when the pain started? Does the pain spread or radiate anywhere, and do you feel tingling or numbness? And then for observation, I would look for edema, which is swelling, redness or erythema, discoloration or bruises, obvious deformities like bumps, and then I would also look to see if the patient was holding their arm for support when they walked in.
Please palpate my radius.
Okay, so the radius is the forearm bone on the thumb side.
Please palpate my radial head.
Here.
Please palpate my ulna.
The ulna is the bone on the pinky side.
Please palpate my olecranon process. Please palpate my humerus. Please palpate my medial epicondyle.
Okay, so the anatomical position, that's this bone right here. It's a bony bump.
Okay. Please palpate my lateral epicondyle.
And that's the bump on the lateral side, right here.
Please palpate my ulnar collateral ligament.
Okay, so that is here.
Please palpate my radial collateral ligament.
Here.
Please palpate my annular ligament.
So the annular ligament covers the radial head, and you can kind of feel it when they move their arm. So can you go like this and then also move your arm this way? So it pops out, and hers is right here.
Please palpate my biceps brachii muscle.
That is this muscle right here.
Please palpate
You
my
want to take your sweatshirt off, maybe?
It's okay. It's just this muscle.
Okay.
Please palpate my biceps brachii tendon.
Okay, so that's right here, and can you bend your arm? Yeah, so when they bend their arm, it pops out, and hers is right here.
Please palpate my triceps brachii muscle.
So the tricep is the one on the back.
Please palpate my triceps brachii tendon.
And that's right above the elbow.
Please palpate my brachioradialis.
Okay, so that's the forearm muscle. So can you rotate your arm inwards and then outwards? Yeah, so it pops out right here.
Please palpate my ulnar nerve.
Okay, so that is in the groove that's right in between the medial epicondyle and the olecranon process, and so you can feel it in this groove right here, but you have to be gentle because it can be kind of uncomfortable or tender.
Please palpate my cubital fossa.
That is this right here.
Okay. Please perform Tinel's sign test.
Okay, so Tinel's sign is for cubital tunnel syndrome. So cubital tunnel syndrome. And hold on, I know it. Oh yeah, okay. So you would do this with a reflex hammer, but I don't have that, so I'm gonna use my fingers. And you basically just tap the ulnar nerve 4 to 6 times. So 1, 2, 3, 4, and then a positive test is pain, tingling, or numbness in the ulnar nerve.
How do you know it's positive or negative?
If they would say that they feel pain, tingling, or numbness right in that area.
Please perform Coxon's test.
Okay, so can you come sit by me? Yeah. Coxon's test is for lateral epicondylitis. So I'm going to have you relax and then put your hand in a fist and then rotate your forearm and your fist inwards. And so I'm going to push down or push that way, and then can you resist? So that's the test, and then a positive sign would be that she feels pain in the lateral epicondyle.
Okay, please perform varus stress test.
Okay, so for the varus stress test, I would have an arm above the elbow on the inside, and then a hand below the elbow on the outside, and then I provide a force from the medial side, and a positive test would be laxity or pain, and then this is for a collateral ligament tear.
Please perform valgus stress test.
Okay, so this is the same, but the hand positioning is the opposite, so the hand above the elbow would go on the outside, and the hand below would go on the inside, and then I provide a force from the the lateral side, and this is also for a collateral ligament tear, and the positive test is laxity and pain. Thank you.